Good morning. It is Tuesday morning, Tuesday the 21st of May. We are almost 6 months into 2024, and boy, has it been a eye-opening experience, revelation in some areas, and a lot of exposure. Because we are getting towards the end and I haven't done this yet, I wanted to have just a little chat about mental health. Yeah. All of you know, well, most of you know that I am a counselor. And when you're working with someone, it'd be easy to say, because there are theories behind mental health or psychological theories, I should say. And so, people always ask, what is your theory and things like that. Most people do a combination because there's not normally one. In a rare possibility, it could be. But for the most part, most people aren't made up like that where you can squeeze them into or squeeze them under one theory. And so I lean a lot towards behaviorism. It's still early in the morning, y'all. And personality theories, a little bit of humanistic psychology, and social learning theories. And for the most part, I like to sprinkle in a little bit of the Freudian. And it has changed over the years. I'm not strictly a Freudian. I do like aspects of his theory. But for the most part, I like to look at behavior, environment, social social influences, I guess that's how I should put it, on a person, and see how that has contributed or helped to create or made the mental health issue that they may be dealing with, or the mental health disorder that they have. I thought it would be fun to make this not so boring, because people who are not into psychology and stuff find this kind of stuff. I'm sorry, y'all, because I'm trying to do two things at one time. I should have went and got my tripod, but I was just being lazy. It can be quite boring, especially when you get into, if you don't like this, when you get into the theories and all that kind of stuff, the different psychiatrists, psychologists, the founders of each theory. It can be a lot. So, I thought we'd just take a look at mental health in the U.S. So, if you all have not noticed, I kind of have an A personality. Not fully, but I do have a lot of touches of A when I say. When I say that, I mean, I like order for the most part. I like to do things A, B, C, D, E, F, G without skipping to Z and coming back to P. But I have learned to be flexible and compromising as I've gotten older. So when I see people give out misinformation, that really bothers me. And the main reason why it bothers me is that we have so many places that we can get accurate, for the most part, information nowadays. It's not like back in the day when if I wanted to know something like how many people, what's the percentage of people in the United States that have a mental illness, you had to go get a not dictionary, encyclopedia. And if y'all don't know what that is, it's a collection of books, and they were very expensive back in the day. And they broke down, it's sort of like a Google in book form, except for you couldn't update it unless you bought a whole new set. So you would have A through Z and all the different things that they had collected as far as information. So if I wanted to find out about mental health, I would go under M and see what they had about that. Of course, they could not fit all the information in there, so you got select pieces. And that's how we looked up stuff. That's how we did homework. That's how you wrote papers, by getting your information from the encyclopedia. But anyway, Now you can pull it from many, many sources, not just Google. You can go and get scholarly information, meaning that people have really done their research. You can see that more than one person may have studied on this. You can see whether or not other peers have read, but it's a peer review. Let's say I wrote a paper on sunflowers. And for me to want it to be, I guess you could say, put out as information to other people, it would be peer reviewed, meaning other people, I don't know what's wrong with my mouth this morning. My peers would be the one that would read this information, and then they would critique it as to whether they go along with it, or even if they don't, if they believe that it's accurate information, right? So for me, in the doctoral program, most definitely, when you write a paper, you never are writing a paper just off of your thoughts. You're having your info, whatever I believe is being backed up by other studies that have already been done before me, unless you're very special and you have been able to create something new, and it's still going to need to be peer reviewed. Because I didn't know, what I didn't know was that people's dissertations were actually, they're bound, they become like a book, but they're actually put out. Like I could go, once I finish mine, and look it up on Google, because it's actually used, well, probably more on a scholarly website, but it's actually used as research material for other people. So what we write on, once it goes through the whole criteria and inspection and all that stuff, it is good enough to put out there that somebody else who wanted to write a paper or do a study on could use my information as a basis of reference for them. Pretty interesting. How do I just go off on a tangent about stuff? All right, I'm 7 minutes in. I ain't gonna be this long. All right, so of the homeless population, and see, this is an issue that has happened in most states and most cities. Years ago, I'm gonna say back in the early 90s was when it really became prevalent that what they decided to do was to close most mental health hospitals. Most of them a lot of them are run by the state, but you have some private ones, but they closed them. And they thought it'd be a good idea to do pretty much like fast food service for mental health. So instead of being taken in, doing research, let me just start over. Maybe I shouldn't have done this today. So instead of them, putting you in the hospital, really examining you and seeing what's going on, and housing you there until they could get you stable, no. The government thought it'd be a better idea that if you come in, you only come for 7 to 15 days, and then they give you some medication, they send you back out on the street. So when that happened, you had people who had from severe to minor mental health disorders or issues, and they really didn't have a place to go, because to be able to go and stay someplace for the 7 to 15 days or to even get evaluated, you had to have health insurance, right? So if you have no health insurance, where do you go? It's extremely hard to get a person who has absolutely no money, no health insurance, to get them into a facility, because in most places, there's not that many. Most of these businesses now that will house a person and keep them in for an extended period of time, it costs. And they're not playing. You're not going to come up in there for free. Sometimes they have sponsorships. Sometimes they have, other organizations that will help. But for the most part, it's like begging and pulling teeth trying to get somebody in, especially if you're in places like where I'm at. We don't have that many here in South Carolina. And it's even fewer for women. So, I thought it'd be interesting to find out what is the population when it comes to homeless people. what percentage of homeless people have mental health disorders? And it is estimated that 20 to 25% of the homeless population, and I'm just taking the United States, suffers from serious mental health issues. And that's compared to only 4 to 6% of the general population of people that live in the United States. So that's quite a bit. That's like a fourth of the people that are out there homeless have some type of mental disorder. And we're not talking about a mild one. It is a serious one. Then what mental illness do most homeless people have? Or what is the most common type of mental illness amongst people experiencing homelessness? Affective disorders such as depression and bipolar, schizophrenia, anxiety disorders, and substance abuse disorders are the most common types. And that's scary to have people who are schizophrenic or bipolar out, even somebody that's depressive, out on the streets and having no place to go. And then to add to that, those people that have those mental disorders, to include anxiety, will then turn around and use substances because it's like you know that there's something not right. You may not be able to pinpoint it, but you kind of know that I'm not thinking clearly or there's something going on. But, and even for people who are schizophrenic, a lot of them will say just to squelch the voices in their head and things like that, they will get high. So now that turns into a person that not only has a mental illness, but now odds are pretty good that they now have a substance use issue on top of it. So that's why you'll find a lot of people with mental disorders use something, alcohol, drugs, something to help them deal with, as they say, make them feel normal. Because the mental disorder doesn't make them feel that way. Okay. So, I want to know, what is the percentage of people who have mental disorders in the United States? So, 22.8% of U.S. adults experience mental illness. That's 57.8 million people. So, to break that down, it means that 1 in 5 adults experience serious mental illness, and then 14.1 million people, and this is like 1 in 10. Well, I'm sorry. 1 in 5 experience a mental illness, any type of mental illness, and then 1 in 20 will experience a serious mental illness. So let's just take that. Look at your family. If it's 5 siblings, at least one of them is going to deal with mental illness. Then if you expand it and say, okay, I'm going to look at my grandmother and my grandfather, the children they had and their children. So maybe 2 sisters and a brother. And so if they're all married and got kids, the odds are good that that's about 20 people. So at least one of those people will have a serious mental illness. So when you start looking at it, it's not that far from home in where you can see some mental illness. If you take your workplace and look around, the first 5 people you see, at least one of them got something going on. And let's say you work in like a call center, it could be 20 people up in there. And at least one of them that you're working with every day got a serious mental illness going on. And it could be unchecked, meaning they're not seeing anybody, they're not taking anything, they're just trying to deal with it the best they can. So the countries with the highest rate of mental illness in the world is Iran, Australia, and New Zealand. Iran I could see because of so much unrest over there. You know, there's always fighting. I was surprised about Australia and New Zealand. And then New Zealand is always on the forefront when it comes to innovative ways of dealing with homelessness, mental illness, things like that. So I was kind of surprised. Maybe they're always on the cutting edge because of the high percentage of people with mental illness. Because they will put money into that type of thing, whereas the U.S., not so much. So then what state has the highest rate of mental illness? And guess, this is what surprised me. Hawaii is leading the pack, with West Virginia right behind it. And West Virginia is the state that stands out the most for the most concerning issues of mental illness. And you would think, these people live on an island. It's so beautiful there. Why would you be dealing with mental illness? You would think the nature would help them out or whatever. Apparently it does not. Then, so where do we as Americans in the United States, where do we rank when we look at the whole world when it comes to mental illness? We are 29th in the whole world. So, depending on how many countries we're looking at, I guess that's not bad. We're not in the top 5 or the top 10. Yeah. 15 million Americans are estimated to have some form of depression. Think about that. I know y'all gonna fuss about this shakiness of the camera. Why is there a mental health crisis in America? And this is what they think. Of course, this is not carved in stone. This is just what they think. Our lifestyles, biological factors, meaning that there's other people in the family, your parents, grandparents, like that, and it trickles down. Poverty, housing instability, lower educational issues, lower income, and lack of health insurance. So when you look at children who are maybe coming up out of the projects, right off the bat, if they're born and living in the projects, they're saying that poverty, and then we know for most cases, the education is different in certain areas. You can look at your own cities. Certain parts of town have the better schools than the other schools. So you think they're putting the better schools in the area where they got the projects? No. So that becomes the lower educational attainment. Then you're living in the projects because your money ain't flowing. You're not getting a whole lot in. Though there are some who get a lot in and just want to live there. So that's debatable on that. But for the most part, most people are living there because that's what they can afford. So then you get the lower income. Then most of the time, if you look at health insurance or anybody that's working, you know how much health insurance is when the employer is trying to get you to buy health insurance. So when you look at, let's say, a family of 4, that could be like $200, $300 some dollars out of your paycheck, each paycheck. Who can afford that? When you're just barely bringing home enough to take care of everything else and the kids and the wife or the husband. So the first thing most people do is don't get no health insurance. A lot of times, if you're living in lower economic situations, you can get assistance with health. And so this is what most of us will do. If my child has Medicaid or my children have Medicaid, then I'm just going to not get health insurance. So then that means that the provider of the home does not have health insurance. And so what do a lot of people do? They turn around and use the ER as their doctor's office. So if you get sick enough or something's going on that's bad enough, you go to the ER. So now that backs up the ER because now they have become many doctor offices, and they should not be. It should be just for emergencies. So this all has a trickle-down effect, all of it. Now, this is not all 100%. This is just averages, stats, and what they think. There's always different circumstances. How things work can be different for different people, So don't get in the chat talking about, I know so-and-so, blah, 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 and this is not. I'm not saying that all of this is 100% whatsoever. Mental health is not that type of area in the sciences where you can say everybody that has depression is going to have this. Everybody that's schizophrenic will do this. It's not like that. At what age does mental illness typically start? And they say that the majority of mental illnesses, and they're going to give 75, they love percentages, 75% begins by the age of 24. However, 50% of all lifetime mental illnesses begin by age 14. So that's why I say that a lot of time they're self-medicating by using alcohol and drugs, because they've known since they were younger that there's something going on. And the funny thing is, most parents know that their child has something going on. Everybody may not be able to pinpoint it, or we may not want to deal with it, but we know. What cities have the highest rate of depression? Lewiston, Maine, Huntington, West Virginia, Spokane, Washington, Burlington, Vermont, and Knoxville, Tennessee. All of those are northern states except for the Tennessee. So I'm going to have to look into that and see why those particular cities have such a high. What city has the most mental illness? And you can kind of tell, especially, I'm not going to get into politics, but out of the top 10 U.S. cities for the worst mental health, dun, 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 Dallas, Texas ranks number 1. And not just Dallas, Texas, Houston, San Antonio, and Austin took the 2nd, 4th, and 9th spots. So just in the top 5 or the top 10, Texas has 1, 2, 3, 4 of the slots. Something's going on in Texas, and we can refer that back to our friend. I don't want to get into the root cause. I was going to, but they're saying that it could be triggered by environmental exposures before birth, exposure to environmental stressors, inflammatory conditions such as toxins, alcohol, or drugs while in the womb. And all of this can just be linked. They're not saying that, that is exactly what it is. They're just saying that they found links from those situations or things to mental illness. All right, I'm going longer than 23. It always takes a long time for my stuff to upload if I do over 20 minutes. So then, who should diagnose you? I see a lot of people on YouTube throwing around diagnoses, meaning, oh, this person is narcissistic. That is the biggest thing right now. Everybody's a narcissist. Or this person got bipolar, or this and that. I heard somebody talking about somebody the other day. I don't like that. Why? Because for one, I found that there are people who were labeled as children to have a certain disorder, and it was inaccurate. And when they're retested and looked at again, the diagnosis has changed, or it could have been just something going on during that time. And because mental health is still a taboo area, you still have a stigma behind it, you don't ever want to label somebody with something that they don't have or label them incorrectly. So I'm very serious about when you start throwing out diagnoses. You've never heard me diagnose anybody. I may talk about the symptoms. I may talk about things that could have contributed to it, such as different traumas. But you're not going to hear me say, oh, this person has this or that. And I've done where, when I've worked in private practice, where, the counselors did not do the diagnosing. And for the most part, it's going to be a psychiatrist, or it should be. Let me just put it like that. It should be. And that's simply because they can do testing. When it comes to different tests, like for depression, bipolar, different tests like that, personality disorders, they can do tests and then they are supposed to evaluate it. But nowadays, it's the computer does it, because when we did testing, we would just have them answer the questions, and then the computer would go ahead and look at the answers and then spit out a diagnosis. But then the psychiatrist would look at everything from the hours of counseling to the testing and anything else that we may have on the person and try to come up with a diagnosis. Is diagnosis perfect? No, it's not. Such as psychotropic medication that they give, it is not. Sometimes it's a trial and error, and that's what people don't like. But for most common issues such as depression and anxiety, your primary care doctor can pretty much go ahead and diagnose that. Especially if it's the same doctor you've been seeing for years, they should be able to at least be able to say, okay, they're acting different, from the time to time that they've been coming, if they don't have too many patients and stuff. But they should have made good notes and they can look over those. For any other mental health issues, it is better to see a psychiatrist. And that's, like I said, because they can go ahead and test you. They should see you over a period of time. And they can, once they diagnose you, they can prescribe medication. The problem with seeing a psychologist or a counselor and them diagnosing you, and it's not that they can't, but psychiatrists are licensed medical doctors who have completed psychiatric training. They can diagnose mental health conditions, prescribe and monitor medication, and provide therapy. That's because they can do it all. They go to school longer. They are a medical doctor. The thing is, nowadays, most psychiatrists are not gonna they're not gonna provide therapy. So what happens is, in the system now, and this is how it should work. Does it work like this all the time? No. So don't get in the chat saying, well, no, it doesn't always. But if you're a good therapist or whatever, you have a person that comes in, you've seen them for, let's say, 4 appointments, and you've kind of noted different symptoms and things like that. What you should have is a psychiatrist or more than one that you have like a good relationship with, that you can refer your patients to that person. So what you would do is you want to talk to your patient, set up or your client, set up an appointment for them to see the psychiatrist, but the psychiatrist has the back information that you have, and then they have them come in and they test them and they go ahead and diagnose them, and they can prescribe medication if the person chooses to want to be on medication. But you're working closely together. But then you would be the one that provides the therapy. Because like I said, most psychiatrists, they're going to write you a script and you're on your own. They really use the counselors and the nurses who work in mental health and things like that to go ahead and get all the background stuff, tell them what's going on with the patient, meet the patient, prescribe, and then the person, I hate saying patient because I think that's not what they're calling them now, clients, send them back to the whoever's doing the counseling and let them do the therapy part. And then just keep them abreast of what's going on with the person. So that's how it should work. Does it always work that way? No, it does not. Do you have people out here just diagnosing because they, in their mind, they feel like they are a doctor? Yes, you do. That was the biggest thing in school was, everybody wanted to diagnose everybody. Everybody in their family, you done diagnose everybody in the family and all that. Diagnosing is serious, and people shouldn't be just running around putting labels on other people. That's not how it works. And it's not, it's just not right. So, that's my mental health little, I guess, conversation for Mental Health Awareness Month. I hope you got something out of it. And for those who found it too boring, this probably wasn't the video to watch. I do want to leave with letting you know that you can always get assistance for those who feel like they may need assistance and you don't know where to start, where you can have somebody refer you to where you can go, whether it's free counseling in your area or you may want to look it up for somebody else. I'm going to give you the 1-800 number for NAMI. And NAMI is the National Alliance on Mental Illness. And so the NAMI helpline is available between Monday through Friday, 10 a.m. to 10 p.m. The number is 1-800-950-6264. And they do have where you could chat with someone. So let's see. You text helpline to, and it's help, HELPLINE, to 62640. And then if it's a crisis, you can call or text 988, and that's for 24/7, 24 hours, 7 days a week. So if there's a mental health crisis with you or someone else, and you need to know where to take them or take yourself or whatever the case may be, or just to talk to somebody, you can text or call 988. So again, the number for NAMI is 1-800-950-6264. And if you just want to chat, you can text helpline to 62640. All right, guys. Let me get to doing what I need to do, and you guys have a terrific Tuesday. Bye.